3, 2, 1, rolling.
Okay. Hi, my name is Eileen Quinn. I'm a registered nurse, so this is part 2 video. I'm going to teach you how to do intramuscular injections. So the difference with this is you're trying to bring the medication into the muscle of the patient, so you're going to choose more muscular areas. You may choose the glutes. Most of the time, though, you're going to be giving the injection in the deltoid because that's where you're going to be giving your immunizations, and that's most of the intramuscular injections. You also can deliver it in the side of your thigh here, but you're going to be giving it in the deltoid. So another point I want to bring up, during intramuscular injections, there's a point of where when you're into the patient, you're going to be aspirating, looking for blood to make sure you didn't hit a big blood vessel. Now, the CDC recommends when you're giving immunizations to not aspirate because you're not having huge blood vessel areas in the top of your arm. When you're doing other injections, maybe an iron injection, or you're giving intramuscular Ativan, because someone's seizing, any of those kind of situations, then you would. But the CDC recommends for immunizations to not aspirate. So we'll continue with this. So in the video before, I had the top on for the vial. This time I don't because I want to just show you, cleaning the top of a vial at least. Probably you would only do this if you're using insulin vials. So you're going to scrub it, make sure it's nice and clean. So we're at 12, 13, 14, 15, 16, 17, 18, 19, 20, 25, 26, 27, 28, 29, 30. Okay, cool. So then you get rid of that one. Okay, so then I'm also using a different kind of needle. Some of your hospitals may use like a more needleless system. So this needle is a little bit different than the blunt needle I used before. So you're gonna slowly loosen the top, let it drop. So this one's a little bit different. It has this little like blue sharp end to it that you're going to be putting in your vial. Again, you're going to still follow the same steps of sterility. You're going to keep this sterile, the top of your canister, and then you're also going to keep the top of your vial sterile as well. So you're going to still get your air. We'll just get 1 cc again. And same principles as following before. I put it again in the crook of my elbow, but again, you can attach it to the table and hold it steady and come from the side, but I'm just going to do it from the crook of my elbow. So you come from the side again, attach the end to the end of the vial and go through. You just make sure your needle's at the bottom below water level. You put your air in, bring your water out or medicine out. Get it to about 1.2, 1.1. Okay, so the difference is with the needleless systems, this blue part is going to stay in the vial. So the needle actually stays in. So then you're not as in danger of poking yourself. So when I remove it, this part stays in. And then this part is smooth. Okay. Because we're going to be attaching the muscular needle, so 1 inch here, we're going to be getting rid of the top of this. But let's get rid of the bubbles first. Get the bubbles to the top. Bring it up to 1. Yeah, there's one that was stubborn. Bring it up to 1. Okay. Good. So the bottom here is at 1. We're good. So then we're going to just hold this in the crook of your elbow, or you can bring it to a table and just unscrew the top. But this isn't sharp. You're not going to hurt yourself. Okay? So then we're going to attach again to your 1 inch needle. And this one is a 21 gauge 1 inch needle. Now sometimes for your bigger patients, you may be using an 1.5 inch needle, but for almost like 90% of my patients, I'm using about a 1 inch because you don't want to use an 1.5 inch needle on a 110-pound patient. That would just be mean. So you don't want to do that. So use your nursing judgment, but if your patient's a lot bigger, then you're going to use your 1.5 inches, and smaller, 1 inch. Okay? So again, we're just practicing the same sterile technique. We're keeping your end here sterile and there. We haven't touched it, so it's all good. Okay, so you're going to bring, this is the safety right here. So you're just going to bring that back. You're not going to be using it yet. And you can just put that down while you're getting your patient ready. So in this video, I will show, you know, bringing the needle back for aspiration. But again, you know, if you're giving an immunization, you don't need to do it. Inside to out. Let that dry for a couple of seconds while you're getting your needle ready for your patient. So you just loosen the top and let it fall. Just knock and make sure you don't have any bubbles. Okay, got a few drips up there, all good. So I'll just move this so you can see it better. You're going to go in at a 90-degree angle into your patient. Bring back the canister. You're looking for blood. Again, this is a fruit, so you won't have any, but in case, you know, you see red, then you would withdraw your needle. You would not be giving this medication. You put pressure where you had the injection. But since, you know, we don't see any, we're going to go through with it and, you know, deliver it slowly. A couple of seconds. Get it out of your patient. And then click on the safety. Once it's on and clicked, then you're good. And that's, you would put a bandage over, you know, the site. Just, there could be a little oozing, and that's it. And that's the end of your intramuscular injection.
And cut.